Every morning, millions of people wake up and immediately jump out of bed, rush to the bathroom, grab their phone, or begin their daily routine without giving much thought to what their body is experiencing. It feels completely normal, especially if you're in a hurry. However, cardiologists have long known that the first few minutes after waking are a unique period for the cardiovascular system. During this time, your body undergoes several natural changes that affect blood pressure, heart rate, hormone levels, and circulation. While most people move through this transition without any problems, certain habits, especially among older adults or those with heart disease, high blood pressure, or diabetes, may increase the risk of dizziness, falls, or, in rare cases, contribute to cardiovascular events. Today we will talk about cardiologists warn. This 30-second morning mistake could increase your heart attack risk. So, before we start, make sure to hit the like button and subscribe to my channel. What happens to your heart when you wake up? While you sleep, your body enters a state of relative rest. Heart rate slows. Blood pressure usually decreases. Breathing becomes more regular. The nervous system shifts toward recovery and restoration. As morning approaches, your body begins preparing for the day. Several natural changes occur. Heart rate gradually increases. Blood pressure begins to rise. Stress hormones such as cortisol increase. Adrenaline levels rise. Your body temperature slowly climbs. These normal biological changes help prepare you for physical activity, but they also increase the workload on the heart. For most healthy individuals, these adjustments occur smoothly. However, in people with cardiovascular disease, the morning transition may require extra caution. Why heart attacks are more common in the morning? Research has shown that heart attacks and strokes occur slightly more often during the early morning hours than at other times of the day. Several factors may contribute to this pattern. Morning increases in blood pressure and heart rate place additional stress on blood vessels. Blood tends to become slightly more prone to clotting after waking. Stress hormones temporarily rise. Blood vessels may become less flexible during this period. Although these natural changes do not cause heart attacks by themselves, they may contribute to triggering an event in someone who already has significant narrowing of the coronary arteries. This is why consistent long-term heart health remains so important. The 30-second morning mistake, jumping out of bed too quickly. One of the most common recommendations from cardiologists is to avoid getting out of bed abruptly immediately after waking. When you stand suddenly, gravity causes blood to pool in your legs. Your body normally compensates by increasing heart rate and tightening blood vessels. In some people, especially older adults, this adjustment happens more slowly. The result may be dizziness, lightheadedness, blurred vision, loss of balance. Fainting. This condition is known as orthostatic hypotension, meaning blood pressure drops when standing. Although orthostatic hypotension itself does not directly cause heart attacks, it can lead to falls and injuries and may indicate underlying cardiovascular or neurological problems. A simple habit of sitting on the edge of the bed for 20 to 30 seconds before standing allows your circulation to adjust more gradually. Dehydration makes morning symptoms worse. After several hours without drinking fluids overnight, many people wake up mildly dehydrated. Even mild dehydration can reduce blood volume, increase heart rate, lower blood pressure, increase feelings of dizziness when standing. Older adults may have a reduced sense of thirst, making dehydration even more common. Drinking a glass of water after waking may help restore hydration, although people with heart failure or certain kidney conditions should follow their healthcare provider's fluid recommendations. Morning blood pressure changes. Blood pressure naturally follows a daily rhythm known as the circadian rhythm. It typically falls during sleep and rises shortly before waking. This phenomenon is called the morning blood pressure surge. In healthy individuals, this increase helps prepare the body for daytime activity. However, excessive morning blood pressure surges may contribute to cardiovascular risk in some people with uncontrolled hypertension. This is one reason doctors sometimes recommend home blood pressure monitoring at different times of the day. The importance of taking morning medications correctly. Many people take blood pressure medications, diabetes medications, or heart medications in the morning. Always take medications exactly as prescribed. Do not double doses if you forget one. Do not stop medications because your blood pressure appears normal. Normal readings often indicate the medication is working effectively. If medications cause persistent dizziness upon standing, discuss this with your healthcare provider. Dose adjustments or timing changes may be appropriate. Why rushing every morning can affect your heart? Stress activates the sympathetic nervous system. If every morning begins with panic, rushing, and emotional stress, your body releases additional adrenaline and cortisol. Over time, chronic stress may contribute to higher blood pressure, poor sleep, inflammation, unhealthy eating habits, reduced exercise. Although occasional busy mornings are normal, creating a calmer morning routine may benefit both mental and cardiovascular health. Healthy morning habits. Cardiologists recommend simple morning habits can support heart health. These include wake up gradually, sit before standing, drink water if appropriate, take prescribed medications, eat a balanced breakfast if recommended, stretch gently, avoid smoking, practice deep breathing, take a short morning walk if physically able, monitor blood pressure when advised. Small daily habits often provide greater long-term benefits than dramatic lifestyle changes. Foods that support heart health throughout the day. Heart health begins with nutrition. Doctors commonly recommend fruits, vegetables, whole grains, beans, lentils, fish, nuts, seeds, olive oil, low-fat dairy. Limiting excessive sodium, added sugars, and highly processed foods helps support healthy blood pressure and cholesterol levels. Dietary patterns such as the Mediterranean diet and DASH diet have consistently been associated with lower cardiovascular risk. Other factors that increase heart attack risk. The morning routine is only one small part of the picture. Major risk factors include smoking, high blood pressure, high cholesterol, diabetes, obesity, physical inactivity, family history, poor sleep, sleep apnea, chronic stress. Managing these factors has a much greater impact than focusing on one isolated morning habit. Warning signs of a heart attack. Seek emergency medical attention immediately if you experience chest pressure or pain, pain spreading to the jaw, neck, shoulder, or arm, shortness of breath, cold sweating, nausea, sudden weakness, lightheadedness, unexplained fatigue. Women, older adults, and people with diabetes may experience less typical symptoms. Never ignore persistent or severe symptoms. Prompt treatment saves heart muscle and lives. Common myths about morning heart health. Several myths circulate online. One myth claims that standing up quickly directly causes heart attacks. Current evidence does not support this. Another myth suggests everyone should drink large amounts of water immediately after waking. Fluid needs vary depending on individual health conditions. Some videos claim one food or supplement completely prevents heart attacks. No single food provides complete protection. Heart health depends on consistent, healthy habits maintained over many years. Questions to discuss with your healthcare provider. Consider asking, is my blood pressure well controlled? Should I monitor my blood pressure at home? Could my medications contribute to morning dizziness? Am I at increased cardiovascular risk? Would lifestyle changes improve my heart health? Regular communication helps personalize your treatment plan. If you like this video and would like to see more like it, please give it the thumbs up, leave a comment, and click the button to subscribe.